Good evening and welcome to Black Pittsburgh Matters. I am Pittsburgh City Councilman Robert Daniel Lavelle.
Hello, I'm Councilman Reverend Ricky Burgess.
So what is Black Pittsburgh Matters? Black Pittsburgh Matters is a series of virtual town hall meetings affirming a citywide agenda that Black Pittsburgh matters. And what does it mean for Black Pittsburgh to matter? It means that Black lives matter. We must be engaged in the protection and the health and safety of Black people. It means that Black communities matter. It means that we must invest in and rebuild Black communities. And it means that Black wealth matters. It means we must increase Black employment and we must provide Black entrepreneurship opportunities.
The Black community has disproportionately been affected by two concurrent crises: the economic crisis, COVID-19 pandemic, and race relations in terms of being both are public health crises here in Pittsburgh. Now, normally, in times of crisis and great change, we would be coming to you as the Black elected officials of Pittsburgh and having meetings across the city with our constituents, partners, and allies. We've done that in the past. Since we cannot do that safely in the current pandemic, we're now using this media and platform to come to you in ways in which we can to talk about what we're doing, discuss public policy and legislation, and programs and policy concerning Black Pittsburgh. These meetings will be available via Zoom, Facebook, YouTube, and the city's cable channel. You can contact or ask questions via the Black Pittsburgh Matters Facebook page, or you can email us at blackpghmatters@gmail.com. Today's town hall meeting topic is overcoming COVID-19 in Black Pittsburgh. Daniel, what's been the impact of COVID-19 on your council district and your thoughts on its impact citywide?
Sure. So the impact on my council district is probably very similar to what you've seen in your district and what we're seeing happens both city and county-wide. If we simply look at the statistics, we know that within the county, we represent approximately about 13% of the population. However, we represent approximately 31% of all the COVID cases, and we actually represent about 21% of all the deaths. So it's having a disproportionate impact on our community. But we're also seeing that as businesses struggle, more than your average businesses, Black businesses are greatly struggling, and many will simply not survive the COVID crisis. We're also seeing it clearly impact our health. We're seeing it impact the educational system. Just earlier today, I was on the phone with Comcast having a conversation about how are we going to ensure internet access to all the students that currently have no internet access, since Pittsburgh Public Schools is now making it mandatory that at least the first 9 weeks are going to be online. And how do parents adjust for that? How do parents who have to go to work, who are the frontline workers, how do they deal with those sort of scenarios? And then what are the employment opportunities that are coming out of this? So it's having a drastic impact, and unfortunately, we know that.
Yeah, I think, Dale, that part of the problem is that we didn't go into this crisis equal, right? That the Black community already had these systemic problems. Black people already have high blood pressure, and because of being Black, and just being racism and the effects of racism, it has not only psychological effects, but physical health problems. In our community, there's not wealth in the community. So our Black businesses don't have savings. And so I think when COVID hit our community, we were already at high risk. I think it's just, taking our community over the edge. I think there's a silver lining. I don't know what you think. I think the silver lining is we now are talking about what it really means to empower Black people. And as you and I talk about, I really think it has to be neighborhood based. That simply having training programs or simply having acknowledging racial problems is not enough. I think we need specific investment in Black neighborhoods, because that's where Black people live, work, and worship. And also, you want to, I think, see tangible consequences of investment. That's what I think. What do you think about that, Daniel?
So I agree with that. I actually think there's a silver lining in part because we were already sort of planning for this moment. I think people need to realize, you mentioned the two crises, the economic crisis and the COVID pandemic, but we, in the city of Pittsburgh, we've been in a crisis within the Black community for a very long time now. And I think those watching need to understand where we are now is sort of an evolution of work we began at least over a year ago when we first declared racism a public health crisis in the city of Pittsburgh, and then working with the mayor's office to establish the Office of Equity and Inclusion. We legislated to create a commission on racial equity. So a lot of the work we've been doing was building up, and then all of a sudden this hit. And so all of a sudden, what we've been saying for the last year or so, now people are hearing it very differently. And now for the philanthropic community, government, all realize they really need to do something about this now. And so in some respects, we've built the infrastructure to actually now activate and turn this crisis into an opportunity for our communities. But to your point of investing, I agree wholeheartedly. We have to invest in the rebuilding of our communities. We have to invest in Black people to explicitly rebuild our communities, invest in their businesses, invest in their homes, invest in their education system. And it has to be extremely, extremely intentional.
Yeah, I think that's right. I think long term, we have to use the social dimensions of health to address the underlying causes to make Black people less healthy and more susceptible to pandemics and other illnesses, the things you talked about in terms of, affordable housing, transportation, education, employment. But today, to give us a clear perspective on COVID-19 in the Black community, we are honored to have with us this evening 3 experts. Dr. Jerome Gloucester, Head of Primary Care Health Network, Dr. Tracy Conde, a practicing family physician, and Olivia Bennett, Chief Operating Officer of the Forbes Fund. We want to welcome you to Pittsburgh, to Black Pittsburgh Matters. And so I guess the first question really is to you, Ms. Benton. It's good to see you. What do you think the impact is of COVID-19 on the Black community?
I would say that, COVID-19 is highlighting not just the discrepancies among social economic strata as a result of the pandemic, but also showing the discrepancies among race. It's destroying, in my mind, the infrastructure of the family, community, and ecosystem. This has kind of the pandemic has lifted the iceberg out of the ocean. We know that Black and brown people have been suffering in America for centuries. And through this pandemic, Black individuals are more, I think, 3 to 5 times more likely than white counterparts to be afflicted by this. More residents in Allegheny County specifically, and in Pittsburgh, and people of color are more likely to be critical workers, 2 times more likely than others to have tested positive with COVID-19 infections, 2 times more likely than others to be hospitalized. And what's most devastating is it's also Black individuals are underrepresented in COVID testing compared to COVID-19 hospitalizations. So in addition to all these things and the pandemic, we also see that this health crisis is likely to create more of an unemployment pandemic. So therefore, there's all these issues that COVID-19 is impacting on the Black community, and that's why the coalition's work, the Black COVID Equity Coalition work, is so critical to make sure that those issues are at the forefront of our conversations and that we're not continuing to leave Black and brown individuals behind.
Dr. Gloucester and Dr. Conte, if I'm not mistaken, I believe you are both members of the coalition Ms. Benson just spoke about. So could you maybe give us a little information on the coalition, but also talk about what steps are being taken to protect the Black community from COVID-19?
I'm honored to be a part of the coalition. It is a group of researchers, physicians, philanthropists, community organizers, all coming together to address COVID-19 in Black communities and to ensure that resources are allocated to be able to care for our communities, to test in our communities, and to provide education in our communities. I think having a coalition with so many diverse people and coming together to provide that interdisciplinary action can really benefit our communities. And I think the work that's been done with the federally qualified health centers and helping with connect them with the Allegheny County Health Department, ensuring that focus is remained on our Black communities has been one thing that this coalition has helped, and to even go beyond COVID to ensure that the health disparities that Ms. Benson talked about, that we continue to address those even when COVID is no longer the main forefront of what we're looking at.
Thank you. Is there anything you would like to add, Dr. Gloucester?
First, thank you as well for the opportunity to join you tonight, and likewise honored to be a part of the Black COVID-19 Equity Coalition with Dr. Conti and the others, as she's mentioned, and Ms. Benson as well. I would just say that as the CEO for Primary Care Health Services and our federally qualified health center, the largest one in this county, I was immediately willing to join and be a part of this because there was an understanding of the federally qualified health center's role of a trusted entity within our communities, within the Black community, and even Primary Care Health Services. We are, a corporation of the 9 health centers in mostly Black communities: McKeesport, Homewood, Braddock, Homestead, Hazelwood, the Hill District, East Liberty, and Wilkinsburg, as well as the West End. And we are a corporation of 130 employees that they're mostly African American, and we have African American leadership and board leadership as well. And so to be a part of this and to ensure equity and to have these partners as that have been formed in this coalition to join us, it's been tremendous for me to be a part of it as well.
So first of all, to those who are watching us, I want to remind you that you can ask questions. We have people monitoring the Facebook page. You can ask questions and we'll try to get your questions in. You can email us at blackpghmatters@gmail.com or just list it on the Facebook page. But doctors, we have you here. Talk to our audience about, and people who are watching and will watch, exactly what should they know about COVID-19? And then what specific safeguards? We've heard lots of things: masks, not masks. So tell us a little bit, both of you, about what we should know about the disease, and explicitly, what do you want us to do?
So I'll let Dr. Conti start as the practicing physician here, and then I'll jump in wherever anything I have to add. But she's on the front lines.
The first thing I think that our community should know is that COVID is in our communities and it is affecting us. And it's affecting us at a higher rate than it is other races. We just recently had a huddle meeting for this coalition, and we were able to get some up-to-date data. And so and this was alluded to earlier, but in Allegheny County, Black people make up 12 to 13%. Currently, as of today, we are 30% of all cases and almost 22% of all deaths. So this is impacting our community significantly, and so it's important that people don't feel like this is a hoax or this is not real. This is real and it's happening. And so what we can do is first recognize that it's there, and then do all those things that everyone is talking about. Wearing a mask. Wearing the mask will protect others from you. It will protect you from spreading it to others. Washing your hands to make sure that anything that you have touched or that you have become exposed to, that you don't expose yourself to that virus. And staying socially distant. And I think that is the one area that people have a difficult time with, because we are communal. We love being around people, but it's so important that we maintain that distance to be able to protect ourselves even more.
The only things I would add, and Tracy and I double team on this many times, so she's probably added this before as well, that as we mentioned, the Black community has entered this crisis not on a level playing field, in that we've had the higher proportion and disparity within many chronic health issues like hypertension, diabetes, down the line asthma. And given that fact, at this time, what I would like the Black community to know and also focus on is that, as we've said, we're looking at COVID-19 and then even after COVID-19, and that we have to be diligent about those health issues and to really take a serious look at our management and getting to see our doctors and making sure we're taking care of ourselves, both physical health and mental health at this time, that can really help us have better outcomes, and then also moving forward. And right now, I know there's also fear within the Black community. I spoke with one of my friends who's in his 50s, and he's a professional, a Black male, and he mentioned that he was due for his checkup, just his yearly exam, and he has a couple health issues, but they're mild. And he said he absolutely was not going to his doctor, even though they assured him, no, we've taken all the precautions, we'll keep you safe. And he just mentioned that, he said to me that, he definitely thought that he was putting himself at risk, because if I go to a doctor's office, there's likely to be someone, matter of fact, what he said to me is, there will be someone there with COVID, so I'm not going. And I think we also have within our history difficulty with trust and of the health systems in the community. And so my message would be to seek out those you do trust, and hopefully there are ones that you know of that are federally qualified health centers. Again, we're in the communities as well, and really be diligent about seeking attention to all of your medical issues at this time as well, and doing all the things that Tracy mentioned.
So following up on that, I then have two questions really. What have we learned anything specific that will sort of inform the way we deal with public health in the Black community moving forward in the future? So you mentioned all the underlying issues that are the reasons why we're getting this at a higher rate, but is there anything else that we're learning through this pandemic that will help inform our community and how we deal with public health in the future, is sort of question one. And then question two, because you mentioned fear, and within the Black community, I've already heard the conversation around if and when a vaccine is prepared, that many Black people simply will not take it because the lack of fear, the lack of trust in government and within medicine. And so what can you tell us about that as well?
I was going to say, since Jerome put it to me, I'm going to put it to him now.
All right, that's fair. And what I would say is that, let's see, we're talking about both fear and remind me of your other question, Councilman Lavelle.
What have we learned through this pandemic that will help inform the way we treat public health in the Black community moving forward?
Well, I think that, I don't know if we've learned anything new, but I think it's really caused us to focus on what we already knew, and if nothing else, caused us to move those things up on our priority list. For instance, the social determinants of health and how those have caused a negative effect on outcomes within our communities. And the whole movement, again, as it was mentioned earlier by Councilman Burgess as well, what potential silver lining being that there's a national movement towards anti-racism and looking at how we can address these things that have really negatively affected us for years, and then in the midst of this crisis have just been devastating. So, I mean, I think that what I'm hopeful for is that coming, through this and then out of it, is that resources are in mass, pointed towards the Black community to address these disparities with the social determinants of health, whether it's workforce development, whether it's increasing the amount of funding for our health centers in our communities, whether it's around the other issues with access to, good food sources, and all of those things within our environment in housing, that those are the things that we now have moved. Hopefully the world has moved higher up on their priority list, to where it's not just something we're going to get around to, but we're going to really in full force address now. And then as far as the issue with fear, I think that part of it, I hate to say, but I think that I look at myself and Tracy and other Black physicians, and I think we have to shoulder a lot of that responsibility of trying to help our community get to a level of having increased comfort level, at least with trusted entities of the health community. And I think the reason why I say I hate to say it, because I think it's a really hard, it's an uphill battle. Like I said, I was talking to a friend that I've known since high school, and there was no convincing him that he was going to the doctor right now. Now I think, maybe after talking a little more, and maybe a couple of weeks down the line here, I might convince him that he should, yes, go to the doctor, because you've got high blood pressure and you've got this, and you do need to go in, especially if they've told you that. I think he had a telehealth visit. That's the other thing I would tell everyone, is that right now, telehealth and the availability to at least have some contact with your medical provider and have them look into some of your health issues, make some adjustments to your treatment plan, can also be very beneficial right now. But those are things that I would think of.
So, Olivia, one of the things when we start talking about the social determinants of health, that means all of the other factors that are low performing in the Black community that bring stressors on physical health, lack of affordable housing, or crime, or lack of quality education, environmental issues. So most of those interventions are done by local faith-based and community-based organizations. And yourself and Fred Brown, your executive director, has been in the forefront. I guess my question is, how important it is, given COVID-19, how important is it for us to provide resources to those local and faith-based organizations? What's the role of philanthropy now in this environment? What's your thoughts?
I 100% agree. I think that we need to infuse our communities, especially those nonprofits and those organizations that are doing on the ground work, with the resources needed to do this work. And additionally, not making those one-off transactions, but talking through longer approaches that address the systemic challenges and the issues that Black and Brown communities face daily, and not just a result of COVID. We know, for example, that a number of individuals lost employment through this pandemic, and those jobs may not come back. So what is needed to help retrain the workforce currently to get them into positions that maybe are less potentially impacted by pandemics and coronavirus, for example, but also longer term approaches to making sure that those investments, whether it be workforce development or directly into the hands of community-based organizations, have the needed impact, and moving our interactions with these organizations to being more long-term and not just when the sky is falling. Right now, these organizations, again, are on the front line. They're the places where folks are going for resources, whether it be food, job training, et cetera, and to not have a robust fund to support these institutions does a disservice, and I think puts more folks in danger.
So you think they're going to be more necessary after COVID than before, or because there's we have, for instance, after school program or whatever the programming is. Do you think these faith-based and community-based organizations are going to be more needed after or during the pandemic than even before?
Sure, I think they're needed anyway, but they may also be asked to pivot. So if you're an after-school program, depending on what school looks like moving forward, your employees may need PPE. Your employees may need more technology to interface with students, and to ask folks to step up and provide resources and provide additional service to the community without providing resource, I think is disingenuous, duplicitous, and does a disservice.
So I'm curious, and Olivia, you can respond, or Dr. Conti, because you did mention Black churches, and there's a lot of conversation, and if Red wants to jump in, feel free. But there is a lot of conversations about what needs to happen within Black churches for two reasons. One, for them to be able to actually hold services if and when they can. A lot of churches are trying to figure that out now. But at the same time, towards Ms. Benson's point, a lot of our churches, and Macedonia, in my neighborhood, does a lot of social service support. They do run the after-school programming. A lot of those resources are coming through the Black church. So what do you think the Black church needs to do to adapt to COVID-19, to potentially adjust to its worship services, but also continue to provide the social services that are so necessary in our community?
I would lean on the professionals, whether it's the doctors on this call or the folks from the health department or the State Department of Health, who can provide guidance on how folks should continue to move forward with, whether it be church services or after school programming. I lean on my original point that says whatever we ask folks to do, we should make sure that that's funded, it's safe, and that folks have the resources they need to continue to providing programs as is, or pivot their work to reflect our social distancing that we're required to do now.
One of the things I would say for Black churches specifically is, the work that's done can still be done even though people aren't in the church building, and the church building should not hold us back from doing work in the community, and we should be partners even when people aren't in the building. So whether that is help coordinate tests or help coordinate meals or doing outreach, it's so important for the church to continue its role as that central function in the community that continues to look out for the people that it serves. And Reverend Burgess, I hope I did that well for you.
Let me sort of ask a more direct question. First of all, I want to thank you and your husband for having led the Black community and the Black church community in Western Pennsylvania on our approach. You've created documents and have been just wonderful to help us. And this is the question I'm getting. Your husband has really helped me to think about, worship and to stay remote. And now, now that the September date's coming, there's many of us trying to figure out when do we bring folk back. And even if we bring them back, it's going to be hard. Do you have a sense as to when, in your mind, it would be safe to come back to worship and gathering? Do you have any sense of that?
I don't have a good sense. I would look at the positivity rates in our community. And I would say, as of today, that rate is still too high for us to consider going back. I think it's, it's working in partnership with your communities. It's looking at your church to see, do you have an elderly population that's more vulnerable? And so if so, do you delay that a little bit more versus a younger population that may not be as vulnerable? Do you have the ability to have social distancing in your church? Because even when we go back, it's not like everything, just because we say go back, that everything's back to normal. We have to function under a new normal. I wish that I could predict this disease and give us a date. I don't think any scientist can tell you that as of right now.
So I'm going to ask you, I'm going to stay on this just a little bit. Hope you don't mind. So in terms of your church, when are you guys, you and your husband are pastors of Emmanuel Baptist Church in Rankin? And so are you guys going back in September? What's your plans on going back in terms of your church?
We are not going back in September. And I think once the September date rolls around, we will continue to evaluate and see when we feel that it's safe. There is no plan to return in September as of today.
And the reason I say that is that I've actually privately told my churches, my church members, that I'm going back when you go back, right? If there's two doctors or pastors, I trust you. When you go back, I'm going back. If you don't go back, I'm not going back to church, because I'm just, again, I want to monopolize this conversation, but when I talked to your husband, he really helped me understand that it disaffects people over 70 and over 60 and 70, mostly in the Black community. Well, that's my whole church, right? And so, one case of COVID could wipe out just the majority of my church members. And so if someone told me you could do something that would kill one of your kids, would you do it? I have 4 kids, and I would say, well, probably not, even if it's only going to kill one of them. And so I feel the same way about my members or my family. I don't want to bring back my membership, even if one person is at high risk for COVID and it causes them to get it. It's not worth the price.
I would agree.
So, Dr. Gloucester, I first came to know you early in this process because of the work you do with the community health centers, and because the community health centers were fulfilling a need that some of the major hospitals were not. Both my job and Reverend Burgess's job, in part, is to provide resources. So I'm curious to hear from you, what resources do the community health centers need above and beyond what you may currently have, that we could help, or we could work with our elected officials on the state level or the federal level? What resources are necessary for us to bring to you in order for you to have a greater impact on reducing this spread and working within our communities?
Well, first of all, I want to thank you for all the support that you and the other Black elected officials have provided to us. And I can thankfully say that right now, in primary care health services, we feel like we have adequate resources as of today to meet the needs that we're seeing in our communities. Having said that, I think a lot of the concern throughout this crisis has been how quickly things change. So there have been days when I've talked to my director of nursing about our PPE and said, how are we doing? And she said, we have enough today, but I don't know if we'll have enough in 2 weeks. And then, then maybe a week would go by and she would say, okay, I did, I wasn't getting any response, but now I got a response and it looks like we're going to have enough for the next month. So it's things like that that we've had to deal with. But I think that with the support that you have given us, and likewise the Black COVID Equity Coalition, to really help all of the health systems and the health department and everyone come together at this time, that's allowed us, for instance, to, I think, be a part of the testing that we are receiving, the testing kits that we get from the health department. And that has been a lifesaver, if you will, and that initially we weren't getting test kits into our communities, and everyone was alarmed, as well as I was. And we, of course, all of us were saying our community should have the most testing, not the least, if we're most at risk. So thankfully, we've had adequate supplies of those things. And I think moving forward, I think the biggest thing that I would ask would be just that continued diligence to help us and look for opportunities where we can continue to get support, whether it's from the county or from other resources that are coming down from the state. Sometimes you'll hear about those things as well. I think those really help us because, as you've mentioned, community health centers were not only just a medical practice with one line of business. We have dental, we have pharmacy, we have behavioral health and mental health, we have social services, and we have a lot of other ancillary staff as well. We have our own laboratory, and so we're really a comprehensive health entity within our communities. And right now, I think that's definitely what's needed.
So just as a quick follow-up question, you mentioned mental health. How do you believe COVID-19 has had an impact on the mental health of the Black community? And is there a need for greater preventative health and mental health services?
I think it's had a tremendous negative impact on Black communities, in that we know that it's affected negatively all communities from the standpoint of just the stress of fear of this thing that could kill individuals. Then for the Black community to know that we're more at risk and having worse outcomes, and now the fear increases. And you hear people in the Black community saying, going to a hospital is like a death sentence, and all kinds of things like that. And then all of that fear increases stress, which increases cortisol levels, which increases often certain systemic things within our bodies that causes our immune system to not function well, and causes other diseases that we might be dealing with, chronic diseases, to have a worse outcome. So I said all that to say just a snowball effect that has happened within our communities. And I think that we once again went into this not on a level playing field, and that besides our outcomes and besides what we were dealing with, there's also been a stigma within the Black community around mental health. And often the same way we've had a distrust with the health systems and more organized medical systems, there's a distrust of the mental health system as well, or also not wanting to be labeled and all those things. And I think that what we need to do as preventative measures are that I think anyone that is just feeling like they are becoming, overwhelmed with these stressors and these issues, even though they don't have perhaps a mental health diagnosis or what have you that they're already dealing with, that I encourage them to reach out to places like ours, or if they know of another trusted entity, that would be fine. But for instance, we have therapists that's what we're dealing with right now. We have employees that are reaching out for behavioral health services right now because they're under a lot of stress. They're on the front lines, and I think that can only help, and those can be really supports that right now will help with coping, help with decreasing stress, and hopefully improving outcomes.
Dr. Carney, one of my fears, and I've read about this, is this whole idea of rebounding, that we may get it in control somewhere in the fall around flu season. This COVID-19 can rebound, and if we're not careful in the Black community, it would rebound first of all in the Black community first, and then spread its way to the majority community. So, you have any concerns about that, and kind of how that would work? And if that is a problem, is there things we can do that prevent that from occurring?
Right. I think we've already seen that occur in our communities. We had this period that everybody was in isolation, and then we had a kind of reopening, and then we saw cases surge again, and it was actually higher the second time it came around. And so we don't know what this will look like when around school starting, around people being more mobile, depending on, the various activities of school, and everybody has a different plan right now. I think the concern is if you layer COVID and then on top of a regular flu season, what will that look like? And so it is so important that we continue in the Black community, especially, to get our flu shots, to make sure that we are not dealing with two different diseases, and that we can focus and try to get everybody immunized against flu, so that is something that we also don't have to deal with on top of COVID. And so it could potentially be devastating for our community to have both flu and COVID at the same time. And so we have to be able to have that outreach and have our patients trust us enough to come in to get those flu shots and get care when they can.
So in a moment, I do want to allow for the questions that people have watching to be read. But since you mentioned schools, I'm a parent. I'm sure there are many others who are parents. What do you say? You should not reopen schools unless X is in place. What is the X?
So
I would say we should not reopen schools unless we have the ability to test children when they show symptoms, that there is an adequate contact tracing mechanism in place for communities. And it's the same thing that I would say with sports. There has to be an organized plan to ensure that kids going to school are safe, that teachers going to school are safe, and then the parents that these kids are coming back home to are safe.
So that leads me to Olivia. I'm very concerned. I read there's a document that's been floating around. We as the Black elected officials have been sort of chatting about this. There was a report that said something like 50% of all Black kids have not done any online learning. So that even when we went into this this non-classroom setting, 50% of our young people did not participate in learning at all. And now that we're going, and then, there was no necessarily education in the summer, and now we're going to spend 9 weeks. If that rate holds up, we have kids that now we have spent almost, 3/4 of a year. They're going to lose almost a school year at the most important time. And so, what can community-based organizations, parents do to kind of, fight against this sort of trend?
I think it's very important to, when you think through, at this point, it's been a little under 6 months since the middle of March when everything happened. So that has been potentially half a year lost of learning. A number of students didn't necessarily have access to technology like they would have had they been in the classroom or having face-to-face interaction. And then some of those critical after-school programs also stopped doing activities because of the pandemic. I would think, I go back to my original point, I think it's incredibly critical to make sure that those organizations that are called upon during this time to provide additional resources and training for students have the funds they need. Also, thinking back to how else can students be educated, whether or not this is through a mentor providing resources or having those virtual settings in classrooms. We need to make sure that folks, especially in our homes, are equipped to do that, and understanding that while schools may be closed down, there are still parents that are going to have to go back to work full time, and they will not be able to provide instruction to their students. So again, working with our nonprofit partners and nonprofit community to make sure that if they are providing technology to students, that they do have the adequate funds to provide that, and also that students in the home have access to internet. I think that's been a really critical assumption that was made, and we've seen that some students just don't have the bandwidth and the capacity to get access to those resources.
I want to at least say one thing that I want to just offer up to any parents that may be watching. If you can, try to spend some mandatory academic time with your kids every day, whether that's a half an hour, an hour, or a couple hours a day, but try to lay aside some period of time every day and have your children do academic things. If it's just reading a book out loud or reading a book or doing math problems or, even creative stuff, but it's absolutely imperative that our young people during this time are reading, doing some kind of math, and engaging in communication skills. So I would just really, I did that with my children when they were young. Every summer we would lay out times for them to read and do worksheets. And so at the very minimum, I would advise every parent every day, at least 5 days a week, to lay aside some time, specific time, to get the kids engaged in academic activities.
So since we're on this topic, I would, and this is very selfish, but I do want to ask one other sort of educational question before I ask Micah to read some of the public questions. There's conversations going around now about educational pods. The idea being that maybe 4 or 5 or 6 parents, all with young children, so in our case, all with children in elementary school, would get together, so as to not to be a burden on one parent always having to maintain this online learning 5 days a week, that maybe 4 to 6 kids will come to our house on Monday, 4 to 6 kids will go to the other parents on Tuesday, the other parents on Wednesday, and we would just have a consistent rotating. One, from an educational standpoint, I think I see value in it. From a health standpoint, I'm very concerned about it, because from my standpoint, once I let 4 of those kids in my home, I'm probably letting about 20 to 30 to 40 other people actually in, because I can't control what those kids are doing when they go back home and what their parents are doing. So I'm just curious, either Dr. Gloucester or Dr. Conti, your thoughts on that as an approach from the health perspective.
I think that anybody that's going to be a part of a pod or a community has to also own the responsibility of what they do outside of that community. And there should be some agreement amongst the group of what's going to be allowed and what's not going to be allowed, because it will affect everybody in that pod. And there have been, I know people who have done that, and it's been very successful. But you have to have full commitment from all parties involved.
Yeah, the only thing I was going to add is that I think that there has to be a full level of trust between these individuals. That, you know, I'm also a pediatrician, my wife's a pediatrician. We talk about, you know, the other parents and families that we trust that are going to follow guidelines. And then even though this family is really close to us, we don't think they're going to follow the guidelines. So we don't feel safe with, you know, with our child going to their house. So, I mean, I think that that's what would need to happen for me.
Thank you very much. Micah Campbell is with us. She is an intern with Reverend Ricky Burgess's office, and she is very much responsible for helping us actually put this on. And so, Micah, I want to come to you. So if there are any overarching questions that have been asked that have not been addressed, if you would like to ask our guests those questions.
Yes, so we have a few. The first is, what do effective long-term solutions for COVID look like for the Black community, and how will COVID affect us in the future?
I think the most effective long-term approach is going to be a vaccine. And part of getting a vaccine is actually having the vaccine trials, and to ensure that, you know, this vaccine affects everyone equally. It's going to be a part of all of us to participate in those trials, and that also leads to the trust issue in the community, and with, you know, prior concerns about, you know, putting something in our communities that, you know, people are not trusting of it. But it's going to be important for people to get vaccinated when that vaccine is available.
Before you ask your second question, Micah, how do we know when it's appropriate to start participating in the vaccine trial process?
I mean, once they bring it to the point that they are able to use it on humans, it has gone through rigorous process, right? They are not just going from an idea to patients. It has gone through several things. And I've seen a lot of people saying, oh, they're just targeting this to Black people. And that is not true. They're targeting it to everybody, but they do want Black people to participate to ensure from an equity point of view that this vaccine is safe for all.
Thank you. Micah?
Our next question is, how is the city going to make up its financial shortfall from COVID-19? And will there be layoffs?
So, and feel free to chime in, Red. As of right now, there are no planned layoffs. We do believe we have a fund balance that is healthy enough to at least get us through this year. I have not looked at the most recent figures, but maybe going back a month now, we were projecting approximately about $128 million shortfall from lack of tax revenue coming into the city. But with that said, because of our healthy fund balance, we do believe we'll be able to utilize that to get us through this year. Now, what happens in 2021, 2022, this is still going to have a drastic impact on the city's budget. And quite frankly, we don't know what that looks like yet. At least I don't, Rev.
Well, I think that if we do not get federal funds to offset this crisis in our city, next year is going to be very scarce. We're not going to be able to carry the workforce. Our largest, one of the largest parts of our budget is public safety, and 90% of public safety is salaries. And so it won't take you long to figure out that if we do not get money from the federal government in the tune of hundreds of millions of dollars, if there's not relief from the federal government, we will not be able to carry the workforce, because we're having a double whammy. On one side, right, COVID is occurring, but on the other side, because of COVID occurring, there's no sports. A lot of our taxing dollars are not now, we no longer are going to be receipt of them. You know, the entertainment dollars, the hospitality dollars, all those taxes that would normally go into the city's coffers are not going to go there. So we have lost a lot of our fund balance for this year. We won't be able to make it up in next year. And if we don't get federal dollars, we're going to be in it's sad, because we just came out of Act 47. We were very, very healthy financially. And now this has, and I think our mayor's made the right decision not to lay people off so the families could, depend on their livelihood. But to be honest, going forward to next year is going to be very, very, very troublesome, unless there is, and this president doesn't seem to want to put money in the democratic cities. And so I don't know what the future holds.
So I believe we promised our esteemed guests we wouldn't keep them for more than an hour. So Micah, maybe if there's one more pressing question, we can ask that and then wrap up.
Yes.
Sorry, I was muted. Yes. The last question is, we know Black people are at high risk from comorbidities due to lack of access and economic status. These are long-term problems to fix. But Black people also live in higher density in social housing, and we ride public transport a lot more. We also comprise a disproportionate number of essential workers. How do we protect ourselves short term when our lifestyles put us more at risk?
My answer to most of it is actually not extremely profound in any way. I'll preface it by saying that. But every time I've been asked this question, I've answered with a lot of what Dr. Conti has already mentioned as well. And that is that I think that we need to be hyper vigilant within our communities about following precautions and limiting risk, so that within every area that you mentioned, whether it's within our housing communities where there's dense population, then yes, as Dr. Conti mentioned, I'm being diligent about social distancing, even though it's difficult. And even though people might act like there's something wrong with me, I'm going to say, I'm sorry. I'm not going to hug you. We're going to air pound or whatever, but I need to follow guidelines to decrease risk, and I encourage you to do the same as well. And whether it's public transportation, whether it's even in our homes, we've talked about on one panel, what about living in a home with an elderly person, and you're going out and then coming back in? Are you trying to think of everything you can do to try to prevent them from getting this and you transmitting it and putting them at risk? And I just think that That's what we can do right now, without money funding, all some of the bigger issues that we're talking about. That what we can do right now is just be hyper vigilant and take this as the highest priority right now in our community, and just follow it. And like I said, also get with your doctors and your medical providers, and make sure you're reaching out to them as well.
And I just wanted to say, the Black COVID-19 Equity Group, this is what they're looking at, right? When we were trying to strategize about where testing should occur, where resources were needed, we looked at, where are the essential workers coming from? Because that was going to be a group that was going to be harder to isolate. Where are there disproportionate levels of access where people could not get to care, so we can get testing to them? And so I think having the knowledge that there is a group that is really trying to work with elected officials, with public officials, to try to get resources to the community where it's needed, can give a little bit of reassurance that people are not forgotten, our people are not forgotten.
Thank you. Ms. Benson, is there anything you would like to add to help us wrap up?
Absolutely. I wholeheartedly agree with everything Dr. Glasser and Dr. Conti have said. I would say that, just because one may be over COVID doesn't mean that COVID is over. So again, please remain hyper vigilant, follow the masking guidelines that are set, and know that, the Black COVID-19 Equity Coalition is not just addressing kind of what's happening now, but also the longer term impacts of what this is going to do to our community, specifically around those comorbidities and workforce development.
Well, thank you very much. And I want to truly thank all three of our esteemed guests for spending some time with us this evening. This was very informative for me, and I hope it was informative for all those that were also able to watch it. So we do want to thank our guest, Dr. Jerome Glasser, who is the head of the Primary Care Health Network, Dr. Tracy Conti, a practicing physician, and Olivia Benson, Chief Operating Officer of the Forbes Fund. And I just want to let everyone know that we are fully committed to addressing these issues and others, and rebuilding our Black communities in Pittsburgh, for Black people, by Black people, and with our partners and allies like the ones who joined us this evening.
I want to thank all of you for watching and participating in this, our first town hall meeting. Remember, you can watch this show on Facebook, the city's YouTube channel, or the city's cable channel. A new meeting will occur every Wednesday in August. Next week's meeting will focus on police violence and the Black community. By working together, united in purpose, we can transform our city, strengthen it for all of its residents. Pittsburgh can only be a city for all when it becomes a city where Black Pittsburgh matters. Good evening, everyone. Stay safe and be blessed.